Let us learn symptoms of psychotic disorders due to medical condition. Psychosis is characterized by following symptoms like delusion, hallucination, disorganized speech, disorganized or catatonic behavior. So, we can see delusions, an unshakable and irrational belief in something untrue. Delusions defy normal reasoning and remain firm even when overwhelming proof is presented to disprove them. Hallucination is psychosis causes false or distorted sensory experience that appear to be real, and psychotic patients often see, hear, smell, taste, or feel things that are not here. In disorganized speech, psychotic patients often speak incoherently, using noises instead of words and talking in unintelligible speech patterns. In disorganized or catatonic behavior that is completely inappropriate to a situation or environment. Catatonic patients have either a complete lack of or inappropriate excess of motor activity. They can be completely rigid and unable to move or in constant motion. Disorganized behavior is unpredictable and inappropriate for a situation, that is screaming in the middle of class. So, we can see the symptoms. Psychosis is characterized by symptoms like delusion, hallucination, disorganized speech, disorganized or catatonic behavior. In delusions, unshakable and irrational belief that something untrue, and delusions defy normal reasoning and remain firm even when overwhelming proof is presented to disprove them. And hallucination psychosis causes false or distorted sensory experiences that appear to be real. Psychotic patients often see, hear, smell, taste, or feel things that aren't here. And in disorganized speech, psychotic patients often speak incoherently, using noises instead of words and talking in unintelligible speech pattern. They are using noises in disorganized speech. And in disorganized or catatonic behavior that is completely inappropriate to a situation or environment. And these patients have either a complete lack of or inappropriate excess of motor activity and unable to move in or in a constant, they are in constant motion, and disorganized behavior is unpredictable and inappropriate for a situation, that is screaming obscenities in the middle of class. Then the symptoms, the main symptoms of this disorder are delusion and hallucination, and there has to be medical evidence that symptoms are a direct physiological consequence of a medical condition. All other mental disorders have to be ruled out before this diagnosis is given. There are many medical conditions that can cause psychotic symptoms. These conditions include epilepsy, multiple sclerosis, central nervous system infections, and migraine. There are two subtypes of this disorder. The two subtypes are delusions and the delusion. The person has delusion. A delusion is a fixed belief that is either false or derived from deception. In psychiatry, it is defined to be a belief that is pathological, the result of an illness or illness process, and is held despite evidence to the contrary. And as a pathology, it is distinct from belief based on false or incomplete information, dogma, stupidity, poor memory, illusion, or other effects of perception. Delusions typically occur in the context of neurological or mental illness, although they are not tied to any particular disease. They are in the context of neurological illness, and they have been found to occur in the context of many pathological states, both physical and mental. However, they are of particular diagnostic importance in psychotic disorders. So, we can see types of delusions. Delusions are categorized into different groups: bizarre delusion, non-bizarre delusion, mood congruent delusion, mood neutral delusion, delusion of control, nihilistic delusion, delusion of jealousy, delusion of guilt or sin, then delusion of mind being read, delusion of reference, erotomania, then grandiose delusion, persecutory delusion, religious delusion, somatic delusion, delusion of parasitosis, delusion of poverty. Then in these categories, the delusions are categorized into different groups, and these types of delusions we will learn on tomorrow. Okay, bye.